I tend to have more right SI joint pain due to some postural tendencies that I have that tend to be very common for most people. So within my pelvis, I tend to have my left hip more oriented forward or externally rotated, while my right hip is more oriented internally or back. So I have more of an open hip position on the left side, and then this closed hip position on the right side. And so because of that pelvic position, one is going to affect my pelvic floor tension. So I tend to have a tighter left posterior pelvic floor. In addition, it's going to affect the muscular balance of my legs. So my right glute med or outer glute for single leg stability tends to be a little bit weaker, in addition to that right quad, while my left leg inner thigh or adductor and hamstring tend to be a little bit weaker. So I'm typically sitting in this position, and due to pregnancy, it's become a little bit more exaggerated due to joint laxity. And so I tend to have more pelvic girdle pain during my pregnancy, and it tends to get worse if I don't exercise or I don't do movements to support finding more of that muscular balance within my pelvis. So for me, my left hip sits more forward as my right hip is shifted more back. So I have more of a closed hip position on this side and more of an open hip position on the left side. In addition, I tend to have more right rib cage compression, and I'm more oriented towards the right side, in addition to a flatter left back. So this back of my rib cage tends to be a little bit more flattened or less extended. And so because of this, I want to address this glute med strengthening so that I can bring my hip more forward in addition to that quad. So I want to strengthen this side to shift my hip more forward. And then I want to strengthen the inner thigh and hamstring to pull this hip more back so I can find a more neutral position within my pelvis. And now I don't want to be stuck in a neutral position. I want to be able to freely move from side to side, but due to muscular imbalances within my lower body, I am being pulled more in this position more frequently. And so that's what's going to cause some of the issues that I have with pelvic girdle pain. And so I want to find this with my lower body. The other half is going to be my thoracic mobility. So because I'm more compressed and oriented this way, I want to focus on releasing and stretching in this right side body. So finding more length on this right side and emphasizing rotation more to the left. And so I'm focusing both on my thoracic mobility and my pelvic mobility to support my pelvic girdle pain throughout my pregnancy.